Hello everyone, April here from Pelvic Balance. I'm back again with my lovely model, and I want to take a closer look at the back part of the pelvis here, where your sacrum, this part here, and your coccyx is. So your sacrum is below your lumbar spine, so it's right below that, and it's a group of fused bones that make up that area. And then the coccyx, your tailbone, is actually the very tip there. So that's the end of your spine. And the reason I want to look at this is because there are a lot of changes that can happen during pregnancy and birth. During pregnancy, we often have these changes in our pelvic position to accommodate for growing weight of baby in front of our body. So a lot of times the pelvis sort of tips forward a little bit. You tend to get more of a curvature in your low back, and that means that the sacrum here can move out this way a little bit. So you get all these different changes, which is not always a bad thing, but sometimes it explains why someone might have increased pain or tightness in an area. Now, we can help with that. So if you have back pain during pregnancy, you don't have to suffer with it. The other thing that can happen is during vaginal birth, our pelvic bones, our sacrum and coccyx, thankfully we have movement in all those areas to allow for baby to move down through the pelvis. So there is some flexibility there. However, sometimes things move a little bit too much. So sometimes people have injuries to the coccyx. I don't want to scare you. That doesn't happen all the time or anything, but it can. The other thing that can happen is after birth, you may experience some discomfort because maybe things haven't gone back to where they normally would be. So your sacral position, your coccyx sometimes gets stuck a little bit. And that's another thing that I help women with. And so that can cause some muscle imbalances, sometimes some discomfort. Could be in the tailbone region, it could be in the low back. You could also have some pelvic floor issues, and I'll show you why. If you look at where these muscles, so the red muscles here, where they're attaching, and then I'll show you from a top-down view, look at where those muscles are attaching into where the bone is. So if you have a difference in the position of the bones, it could contribute to increased tension in the muscles. So that's definitely something we have to take into consideration when we're dealing with any pelvic issue, low back issue, hips. It's all sort of related. So that's where we have to put the pieces of the puzzle together to figure out what is causing this issue. So I just wanted to explain a little bit more of the anatomy there and how it relates to pregnancy and postpartum and what issues can happen. So if you have any questions, please feel free to reach out, April@pelvicbalance.com. Thank you and have a great day.